Hey, Foreman, got a minute? So, pulmonary resistance is stabilized for the two kids, but BP still.
No news then. How's Cameron?
Dr. Cameron?
Sure. Let's start with her and move on to all the other Camerons we know.
I'm sorry, I'm just not used to you asking about someone's well-being.
I can understand how the question would surprise you. I don't quite get how it would confuse you.
How do you want to know?
Why do you want to know? Why I want to know?
Just curious?
Me too.
You don't get curious.
I'm the most curious man in the world.
Not about trivialities.
Well, then this must not be trivial. How is Cameron handling everything?
Just fine.
Great. Glad we talked. Your husband is definitely the source of your mono.
Oh, wow. Oh, thank God. Wow, I'm going to be a mom. Whoa. Thank you so much. I got to get you a gift or something.
Sometimes the best gift is the gift of never seeing you again.
Rudolph the red-nosed reindeer.
We are condemned to useless labor.
Fourth circle of hell. Charting goes a lot faster when you eliminate all classic poetry.
Writing down what we already know to be read by nobody. I'm sure Dante would agree that qualifies as useless.
You're over 2 weeks behind in your charting.
Oops, I missed.
What are you, 8?
Could an 8-year-old do this?
Better stop or it'll stick that way. You have a patient in exam 1.
Yeah, see, I'm off at 12 and it's already 5 off.
She's been waiting for you since 11.
Melancholy without hope. Which circle is that? Hi, I'm Dr. House. What seems to be the problem?
Show him your hands, Augustine. It looks like stigmata. Pious?
Must be all the talk around the holy water cooler. Been washing a lot of dishes recently.
I help out in the kitchen.
Anything new in the kitchen?
We just got a donation of saucepans and pots this week. I unpacked and washed them.
Should have spent your time saving souls. It's easier on the hands. This is contact dermatitis. You're allergic to dish soap.
Nonsense. We've always used that soap. Why is there a problem now?
I've been a doctor for years. Why do I have to keep assuring people that I know what I'm doing? A person can become allergic to substances that they've had repeated and prolonged exposure to. The good news is, free samples. Diphenhydramine, it's an antihistamine. It's going to stop the allergic reaction. Take one every 8 hours. Might make you feel a little sleepy. And get some of that over-the-counter cortisone cream.
Thank you, Doctor.
You want some water?
Absentee.
Well, just relax for a few minutes. Stuff works pretty fast.
Still out by 12.
How do you solve a problem like dermatitis?
Well, Doctor, I want to thank you for your patience.
Is she talking to you?
I don't know. She's certainly looking at me.
Oh, it's good to get a secular diagnosis. The sisters tend to interpret their illnesses as divine intervention.
And you don't? And you're wearing an awfully funny hat. Excuse me.
If I break my leg, I believe it happened for a reason. I believe God wanted me to break my leg. I also believe he wants me to put a cast on it. Doctor, something's wrong.
Lift up your chin. Sister, you're having an asthma attack. I need you to relax. Roll up your sleeve, please. If you have an effort, open your lungs and help you breathe.
What happened?
Did she take the pill?
Yes.
It's probably an allergic reaction.
She's allergic to an anti-allergy medicine?
Figure somebody's out to get her. How are you feeling?
Better.
I'll put you on some steroids instead.
My heart's supposed to be feeling so funny.
It's called adrenaline. Makes your heart beat fast. Not this fast. Get a nurse, please.
Help! Somebody help us!
Somebody get in here!
Call a code and charge up the defibrillator. She's got no pulse.
Diagnosed the patient with allergies and prescribed antihistamine. She went into respiratory distress, and you injected her with epinephrine, presumably 1 cc.
0.1 cc. That is the standard dose. That is what I gave her.
People don't go into cardiac arrest with 0.1 cc epinephrine.
She must have a pre-existing heart condition that got exacerbated by the epinephrine.
It's too bad you didn't make a notation in the chart.
I can make it up right now.
The drawer has syringes with both dosages. You could have easily reached for the wrong.
But I did.
Everyone makes mistakes. This is why doctors pay for the nose for malpractice insurance.
Relax, you're not going to sue. Worst they do is whack my hand with a ruler.
And the discipline board, are they going to whack your hand too?
You're going to report me?
What choice do I have?
How about not report me?
I can justify keeping her here for a 24-hour observation. If you haven't found an underlying cause for the cardiac arrest by then, I will have to notify our attorneys.
Her hands were really swollen. Maybe she has a skin infection. Cellulitis. That could manifest with tachycardia.
There's no history of fever. Results from CBC didn't indicate an infection.
Eosinophils were mildly elevated. Separates up a bit. We were looking at a systemic allergic
It's
response.
not allergic. Allergies don't cause cardiac arrest like this. The inflammation of the blood vessels.
Vasculitis? That wouldn't give you an elevated eosinophil count.
Church-Strauss vasculitis would. Blood vessels of the heart, lungs, and skin become inflamed, causing the asthma, rash, and heart problems. Covers all her symptoms.
We need a biopsy to diagnose.
Just say to you be quicker. The lady just came in with a rash.
What the hell are those?
Candy canes?
Candy canes? Are you mocking me?
No. It's Christmas, and I thought,
Relax. It's a joke.
Isn't the prognosis for Church-Strauss a bit grim?
yeah. Untreated, only 33% of patients survive past a year. Treated 5 years.
Then I definitely suggest treatment.
If it was any other attending doctor, I'd say that he made a mistake and gave her too much epinephrine.
Saying you wouldn't say it was my mistake, saying it was my mistake.
Everyone screws up. Your rules. I think you fit within the subset of everyone.
I didn't screw up. Order a chest CT and start the sister on prednisone, 40 milligrams TID.
The sister.
What didn't I mention? Patient's a nun. Sister Augustine.
I hate nuns.
Who doesn't?
Sister Augustine? We weren't watching. We were trying to see if this is the bed control.
Oh, this one's the bed control, and that's the TV control. I'm Dr. Cameron. This is Dr. Chase and Dr. Corbett. I haven't seen television in over 20 years.
Do you consider it the work of the devil, or do you just not get cable where you live?
How are you feeling, sister?
I seem to be a little better. They gave me some medication.
Prednisone. It's a steroid to help with the inflammation.
Has Dr. House figured out what I have? Will I be okay?
We're not sure what's wrong yet. You'll have a chest CT scan this afternoon. It'll help with the diagnosis.
Dr. House was giving her medication and he doesn't know what she has.
Trust Sister Pius.
It all happens for a reason.
He doesn't know what he's doing. The only problem that woman has is that House grabbed the wrong syringe.
You don't trust him?
I don't trust a man who won't admit he might be wrong. I noticed you weren't so quick to tell her she's got Shirk Strauss and only has a
I
couple of
don't
years
tell
of life.
patients bad news unless it's conclusive.
Because you know he might be wrong.
About Shirk Strauss, not about what happened in the clinic.
What about you, Chase? You think he's infallible too?
All I know is if House didn't make a mistake and Sister Augustine has Chirk Strauss, he'll be self-satisfied and our lives will be good for a few weeks. If House did make a mistake, he'll be upset and our lives will be miserable for months.
There is that.
If Cuddy thinks I made a mistake, the least you can do is suspend me from clinic duty.
She doesn't confuse making a mistake with being incompetent.
Oh, here we go. Lesson time. I recognize that confidence is not my short suit. I also recognize that I am human and capable of error.
So you might have screwed this up?
No.
So it's merely a theoretical capacity for error.
Good point. Maybe there isn't one. Maybe that's my error.
You know, most people who think as much of themselves as you do like to talk about themselves.
People don't like to listen. So what's wrong with you? Let me guess. Inflammatory bowel.
Wow, yeah. Is it that bad?
Yes. It's also written on your chart. Bloody diarrhea, gas, pain. Took sulfasalazine, but it didn't work.
Then I
Tried steroid enemas, oral corticosteroids, 5-ASA, 6-mercaptopurine. Impressed
by my medical history,
by how well your last doctor charted.
it's one thing to have to go to the bathroom every hour, but when the kids sit on my lap, the store sent me home, they're going to fire me. Can't you put me back on 5-ASA? Maybe it'll work this time.
Not likely. You know your prescription. It's cheap, which is good. So your insurance company won't pay for it.
Cojarius?
Cigarettes. One twice a day. Or no less. Studies have shown that cigarette smoking is one of the most effective ways to control inflammatory bowel. Plus, it's been well established that you look 30% cooler.
Are you kidding me?
About the looking cooler, yeah. The rest is true.
Isn't it addictive and dangerous?
Pretty much all the drugs I prescribe are addictive and dangerous. The only difference with this one is it's completely legal. Merry Christmas.
I was talking to the nurse. Arsenio, do you know him?
Not really.
He can take pictures with his phone.
Cool.
That woman from the lab was interesting too. She studied astrophysics before becoming a nurse.
You know the stuff better than I do.
Well, I'd love to hear all about people.
Yeah, you live in a monastery.
It's where I serve our Lord and the world best.
Our Lord, maybe. The rest of the world, on the other hand, would probably get more out of feeding the homeless or
Healing the sick.
As an example, yeah.
Do you always want to be a doctor?
Always. You always want to be a nun?
My parents died when I was 6. I was raised in a foster home run by the church. When I was 18, I went to the monastery where they let me take my vows. I've known no other life and I haven't wanted to.
Okay, sister. We need you to lie as soon as possible. If you get scared, just let us know.
As Jonah said from inside the whale, when I had lost all hope, I turned my thoughts to the Lord.
At least she's got God on her side.
I don't believe in God.
You're not even a little agnostic.
Is it supposed to smell funny?
Someone rocked in there this morning. We cleaned it up, but
It's normal, sister. It's just a few more minutes.
even a higher order that's in control of what happens, but not one anthropomorphic entity called God that's concerned with the everyday workings of you and me.
What else is there to control but the everyday workings of you and me?
It's always about you, Foreman.
So what are you talking about? The trees, the fish? Should they be the ones that think it's all about them? What about you, Chase? You believe in God?
I believe Sister Augustine has no vascular pathology, which means no Joe Strauss.
Which means House made a mistake.
No, not necessarily. It could be something else. Neurotoxicosis or a carcinoid.
I can get you. You don't believe in God, but you're willing to put complete faith in one man?
Please. Stop.
Let's get her out of there.
I'm coming, sister. Gotcha.
No smoke.
No, God. Oh, it's Jesus. It's Jesus. He's coming for me. He's burning me with his touch.
Let's get over some Ativan.
Please.
Smells religious vision, symptomatic temporal lobe swelling. We don't want her to.
Oh, she's easy. Come on.
Help me get her on her side.
Religious visions?
Yeah. And next comes. Patient tested positive for herpetic encephalitis. So what's that tell us?
That means she was severely compromised.
Oh, I know. Prednisone compromises the immune system. Isn't that the medicine that you gave her for that thing she doesn't have?
Yeah, but. Hey. I'm thinking that's a trick question.
Your immune system is severely compromised. 2 doses of prednisone wouldn't do that.
Are you hanging your diagnosis on an advert?
In 10 seconds, I'm going to announce that I gave her the wrong dose in the clinic.
You can admit negligence?
Unless you leave the room. If you stay, you'll have to testify. 5, 4, 3, 2. So there I was in the clinic, drunk. I open the drawer, close my eyes, take the first syringe I can find. So, what are the options for compromised immune system?
Mixed connective tissue disease. It'd explain why she was feeling better on the prednisone.
Sure, she was feeling better right up to the moment it almost killed her. On the other hand, it explains the symptoms. Swollen hands, pulmonary problems, cardiac problems, it all fits.
Except her ANA was normal.
So redraw the blood.
The treatment is corticosteroids, prednisone. And we can't go there because of the encephalitis.
And we'll treat with something that modulates the immune system but doesn't suppress it. Hyperbaric oxygen chamber.
There's no protocol for putting a patient in a high-pressure oxygen room to treat autoimmune problems.
Oh, you people, always with the protocols. Prep the nun and discontinue the prednisone. I am both amused and annoyed that you think I should be less stubborn than you are.
You are aware of the Hippocratic Oath, right?
When it starts first, do no harm, and then goes on to tell us no abortions, no seductions, and definitely no cutting of those who labor beneath the stone. Yeah, took a read once, wasn't impressed.
Hyperbaric treatments could cause oxygen toxicity, lung and eye damage.
Every treatment has its
Which
dangers.
is why we only treat if we're convinced the patient actually needs the treatment.
I'm convinced. You're not. The question is, what are you going to do about it?
I have an opening Thursday at 3. Do you have a 4th? Is it any good? Can I call you right back? Okay. What's up?
The pressure will force the oxygen into your system, saturate your blood. It will enhance white cell activity, reduce the inflammation.
And that will help with this mixed connective tissue disease.
We'll be doing about 10 treatments and then we'll reevaluate.
The last treatment with prednisone causes seizures, right? How confident is Dr. House about this? That you reacted so strongly to the prednisone let us know that you had an underlying problem with your immune system. I guess it was a blessing of sorts.
So who's your favorite reindeer, Rudolph? I would have thought it was Vixen. What are you implying? Nothing. But I saw you at the Christmas party with Dr. Miles and Dr. Jenkins and
I was just doing some Christmas dancing.
This is a chapel.
Oh,
A house of prayer.
House of prayer. Huh. That explains the good reception. Also, why nobody's ever here.
I need to talk with you, Dr. House. Sister Augustine believes in things that aren't real.
I thought that was a job requirement for you people.
She's been known to lie, to get sympathy. She's a hypochondriac.
So you're warning me that I could be treating a non-existent ailment.
Sore throats, joint pains. There's always something wrong, and there's never a reason for it. Mother Superior plays right into it. Lets Augustine off work duties, treating her as fragile, special.
That must make you angry.
Bothers me. It's not really in Augustine's best interests.
You want some?
I shouldn't.
I guess you gotta be good at reading people to be a good infirmarian, huh?
Mm-hmm.
So we got pride, anger, envy, gluttony. That's 4 out of 7 deadly sins in under 2 minutes. Do people keep records of these things? Is there Catholympics?
They say you have a gift.
They like to talk.
You hide behind your intelligence.
Yeah, it's pretty stupid.
And you make jokes because you're afraid to take anything seriously. Because if you take things seriously, they matter. And if they matter,
When things go wrong, I get hurt. I'm not tough. I'm vulnerable.
I barely know you. And I don't know if I'm right. I just hope I am. Because the alternative is, you really are as miserable as you seem to be.
You know, from the way you're looking at me right now, I see you just hit number 5. Lust.
Dr. Miles, I love you too.
How are you feeling?
A little weak.
That's from the oxygen.
My mouth is dry.
Okay, well, I'll get you some of your tea.
Mixed connective tissue disease? Her AMA is barely elevated.
Well, thanks for checking up on her. Good to know you got my back.
O2 sats down to 83. Pulmonary problems, breathing problems.
Irritation from the oxygen is typical.
She comes in with a rash and you put her into cardiac arrest.
That well just never runs dry, does it? If there was no underlying problem, why is she still having a rapid heart rate?
Maybe from the herpetic encephalitis caused by you giving her
Her
prednisone.
reaction is a symptom, not an error.
There's always an explanation, isn't there?
Yes, there is. If this one doesn't work, we'll find another.
But never one involving you screwing up.
One that fits all the facts. Look, we obviously have a difference of opinion, and that's fine. But unfortunately, I've used up all the time I budgeted today for banging my head against the wall.
I'm going to do you the biggest favor one doctor can do for another. I'm going to stop you from killing your patient. You're off the case. We're going to treat the symptoms, not the underlying condition. There is no underlying condition. What's her status?
The sister's breathing is labored.
Pneumonitis from the hyperbaric chamber put her on 40% oxygen until her O2 sats increased.
The UN and creatinine rising, ALT and AST twice the normal range.
Could be from the hypertensive episode. Let's follow them with labs.
She still has the rash and the joint pain she came in with.
Order a non-steroidal
When
anti-inflammatory.
we were looking at the differential diagnosis with Dr. House, we were considering.
I don't need to hear what Dr. House was considering. All of this woman's symptoms can be traced to Dr. House's considerations. Okay. Let's just get this patient healthy. I want her going out the front door and not the back.
Hey, it's not like I betrayed him. Cuddy would have found out about the hyperbaric treatments eventually.
You did what you felt you had to.
Can't get enough of this place, huh?
my stethoscope.
So I shouldn't read too much into the fact that you were looking for it in the drawer with the epinephrine syringes in it?
Okay. Yeah, I like to clear my reputation.
Oh, right. I forgot how much you care about what people think. Prescribing cigarettes for inflammatory bowel?
So, it causes lung cancer, you know. You know why they have ribbons for breast cancer, colorectal cancer, prostate cancer, and not for lung cancer?
They ran out of colors.
Because people blame lung cancer patients. They smoked, they screwed up, they deserve to die. The reason people die from lung cancer is guilt.
Huh. Well, guilt does a lot of damage.
You said that with great significance.
You're not here to find your stethoscope. You're not here to clear your reputation. You're here because you're having doubts. You might have screwed up.
I'm here because if I'm right, Cuddy is killing that patient.
Okay. But if you're wrong?
And she's saving her.
Fine. You're going to have to go through every record of every patient who's been through this clinic in the last 2 days. And you're going to have to hope that those records can be trusted. Which, by the way, yours can't.
These pills will help your kidneys function a little better, sister.
Hit your wrist.
What's that?
104.
Is that good?
It's fine.
You're a lousy liar, Dr. Chase.
I have to get this. Excuse me.
My mother's been dead for 10 years.
But she's always with you in spirit. What do you know about the nun?
Which one?
The cute one. I think she likes me. The sick one, obviously.
Her parents died when she was a child, and she's been with the church ever since.
What's she lying about?
Why do you say that?
I always say that. And the old nun thinks the sick nun is a big fat nun liar. You know nuns, what do you think?
I don't know nuns.
You hate nuns. Can't hate someone if you don't know them.
You know any Nazis? Maybe I hate them on principle.
I have a theory about what makes good boys good. It's not because of some moral imperative. Good boys have the fear of God put into them. Catholic Church specializes in that kind of training. To make good boys afraid of divine retribution, so they'll do what their daddies tell them. Like, for example, going into medical school when it's the last thing they want to do. What do you think?
I think if she did have a secret, her boss would know.
Did you paint or put in new carpets recently?
No.
Anyway, she could have got access to drugs.
Well, we lock all our medications in the infirmary and we don't keep prescription drugs here. Why haven't you asked Sister Augustine about these things directly?
I found that when you want to know the truth about someone, that someone is probably the last person you should ask.
And have you been speaking to Sister Eucharist?
She ratted out her fellow sister pretty quickly. If I were you, I'd have her repeat a year in nun school.
Becoming a nun doesn't make you a saint.
Becoming a doctor doesn't make you a healer.
And just because we live in a monastery and we spend most of our time in prayer doesn't mean we don't find time for drama.
So what is the sick one's drama?
Sister Augustine lived in Catholic foster care until she came to us. Tea?
Sure. Do all of you lie? It's good strategy. It's simple when you all tell the same lie. She has not spent her entire life as a good Catholic. When she had a cardiac arrest, I had to open her blouse to do CPR. I learned two things. Nuns can have nice breasts, and she has a tattoo on her shoulder of a skunk. Yeah, maybe it's the sacred skunk of Joseph. As far as I know, Catholic foster care and monasteries do not keep tattoo parlors and refectories.
We consider that our life begins when we put on our habits and take our vows. What happens before then?
It's irrelevant to you, but it's relevant to me.
Sister Augustine went into foster care when she was 6 years old, but she left when she was 12. She lived on the streets. She got into drugs. When she was 15, she became pregnant, tried to self-abort. She lost the child. She became ill. We took her in when she came back. If we had thought it was medically relevant, we would have told you.
It's not. This tea is delicious. Local herbs.
Any change with the medication?
Yes, she's getting worse. Lung function's deteriorating, but UN and creatinine continuing to rise. She's starting to run a fever and the rash is spreading. But this rash is not going to Christmas.
Maybe House was right. Maybe there is an underlying condition that explains the symptoms, something we haven't considered. Like what? It could be a metabolic disorder, specifically. Genetic, specifically. I'm just saying.
You're just saying you think House is right.
Might be right.
Of course he might be right. It might be the hand of God at work. Don't say it's something else unless you've got something concrete to offer. What's this, hemlock?
I'm going to do you the biggest favor one doctor can do another. I'm going to stop you from killing your patient. It's a big word, tea. Great for that little pick-me-up we're all looking for in the morning. Opens the lungs, increases the blood pressure, stimulates the heart. Unfortunately, if you then get injected with even 0.1 cc of epinephrine, instant cardiac arrest. Still, what the hell, it tastes great.
Sister Augustine
has been drinking it religiously, so to speak.
Take the cardiac arrest out of the equation.
All the rest of the symptoms can be explained by a severe long-term allergic reaction.
That's what Cameron said in the beginning.
Yes, she did. Well done. But your unwillingness to stick by your diagnosis almost killed this woman. Take a lesson from Foreman. Stand up for what you believe. Okay, let's go figure out how to save a nun.
Tell me if you do, tell me if you don't.
It's been untreated for so long, it's gone from a simple watery eyes, scratchy throat allergy to a whopping I'm gonna kick your ass allergy, compromising her immune system, diminishing her ability to heal, and breaking down her organ systems. So, what's the source? The dish soap. No, symptoms persisted days after the dishwashing episode. It's gotta be something she's been exposed to here in the hospital as well as the monastery.
What about the tea? It caused her arrhythmia.
It could be, but it's not definitive.
We'll skin test for allergens.
Not yet. She's too reactive. She's positive to everything. We need to stabilize her, isolate her from all possible allergens, give her system a rest.
Get her in a clean room.
Okay, we'll gradually introduce allergens and see how she responds. When she reacts to something, we'll know that's what's killing her.
There you go. No television, no books.
My Bible.
I'm afraid not. This room has filtered air, filtered water, even have silk sheets. Very decadent and hypoallergenic. You should be feeling better here.
We'll be back to check on you in a little while.
Can the other sisters come in and pray with me?
It'd be better if you don't have any visitors. Once we isolate what's causing your allergy, then we can be a little more lax. I can pray with you.
I want to die. Why has he left me?
I was in seminary school. They asked us once what our favorite passage was. I chose 1 Peter chapter 1, verse 7. These trials only test your faith to see whether or not it is strong and pure. Your faith is being tested. As fire tests gold and purifies it.
And your faith is far more precious to the Lord than mere gold. So if your faith remains strong after being tested, it will bring you much praise and glory and honor on the day of his return.
He hasn't left you. The only thing in the way of you knowing he's there is your fear. You have a choice. Faith or fear. That's the test.
Choosing faith doesn't mean I won't die.
But it will affect how you experience your death. And therefore your life. It's up to you.
Why did you leave seminary school?
That test. You passed. I didn't.
We'll call you back when changes.
Will she be all right?
As long as she's not exposed to anything that can aggravate her allergy, she'll be fine.
Helping hand. Where is it, Mercedes? She's in anaphylactic shock. No way, she's in the damn clean room. You kidding me? Get in here. What do you want to say, Betty? Anyway.
I got it. Put the end in there. And then
We will stay lives.
It's a clean one.
How do you get an allergic reaction in a clean room?
Maybe it was the preservatives in the IV.
Check that.
Latex tube?
Check that. Check everything.
Well, it could be mast cell leukemia. It can cause anaphylaxis.
Check the blood levels. And it's not eosinophilia or idiopathic anaphylaxis.
Maybe it's just divine will.
It's not my will.
You do realize if you're wrong about the big picture, that is, you're going to burn, right?
What do you want me to do? Just accept it, pack it in?
Yeah. I want you to accept that sometimes patients die against all reason, and sometimes they get better against all reason.
No, they don't. We just don't know the reason.
I think the nuns would agree with you on that.
I just wanted to say that I know that you did everything you could.
I don't need verification from you to know that I'm doing my job well. That's your problem, not mine.
I was just being nice.
Yeah, well, you don't need to always do that.
Merry Christmas.
Sister Augustine's been extubated.
Good.
She's requested to check out against medical advice. She wants to go back to the monastery.
Well, talk her out of it.
I think I may have talked her into it.
Room's paid up for the rest of the week. Might as well stick around.
This illness is a test of my faith. If it's His will to take me, it doesn't matter where I am. I can accept that.
Does anybody believe anything you say? You're not accepting. You're running away, just like you always do. Ran away from the monastery, get laid. Ran away from the real world when getting laid didn't work out so good. Now things aren't working out again, so off you go.
Why is it so difficult for you to believe in God?
What I have difficulty with is the whole concept of belief. Faith isn't based on logic and experience.
I experience God on a daily basis. And the miracle of life all around. The miracle of birth. The miracle of love. He is always with me.
Where's the miracle in delivering a crack-addicted baby? You're watching her mother abandon her because she needs another score. Miracle of love. You are over twice as likely to be killed by the person you love than by a stranger.
Are you trying to talk me out of my faith?
You can have all the faith you wanted. Spirits in the afterlife, and heaven and hell. But when it comes to this world, don't be an idiot. Because you can tell me that you put your faith in God to get you through the day. But when it comes time to cross the road, I know you look both ways.
I don't believe He is inside me and is going to save me. I believe he is inside me, whether I live or die.
You might as well live. Got a better shot betting on me than on him.
When I was 15, I was on every kind of birth control known to man. And I still got pregnant. I blamed God. I hated him for ruining my life. But then I realized something. You can't be angry with God and not believe in him at the same time. No one can. Not even you, Dr. House.
How'd it go? She has God inside her. It'll be easier to deal with a tumor.
Maybe she's allergic to God.
Look everywhere for an allergen that could be causing this reaction except one place, inside her.
On medical history, she didn't mention any surgery.
She had one.
Can we get a record? What hospital was it
I
at?
didn't have it at a hospital. Order a full body scan.
What if she refuses?
Tell her I'm looking for a miracle.
No piercings, no fillings, no surgical pins in the arm, no implants.
It's plain as a whistle. What's else looking for? What is that?
Don't know.
Work on it. Get a 3D representation.
Oh my God.
The copper cross form of birth control pulled off the market in the 80s.
So she's allergic to copper.
Rare, but it happens.
Didn't she know she had an IUD?
She had an abortion. IUD must have been left in and embedded in the endometrial tissue where it couldn't be detected.
So all we have to do is remove the IUD.
Then the symptoms should subside.
I got this IUD when I was 15. It's been more than 20 years.
No prolonged exposure to an allergen with minimal symptoms. But at some point, all it takes is one last contact to cause a full-blown reaction. It's like a balloon filled with air, one last breath. It explodes.
The first time I got the rash was when I was washing the copper cookware.
And all your subsequent symptoms came from ingesting food prepared with it.
Dr. House found this miracle.
I doubt he'll interpret it that way.
You told me your favorite passage. Would you like to hear mine? Celebrate and be glad, because your brother was dead and is alive again.
The prodigal son.
He'll be waiting for you when you're ready.
We'll schedule your surgery for tomorrow.
The sixth circle of hell.
Confined in a sweatbox with a bloody nose and all the tissues are soggy.
I think that's the seventh.
No, the seventh
God,
is when
you must be fun at parties.
I think we both know the flaw in that theory.
How's the sister?
Heart rate is normal, kidneys functioning. You know how it is with nuns, you take out their IUDs, they just bounce right back.
Great.
Told you I didn't screw up.
You screwed up.
I gave her 0.1 cc of epinephrine.
Yeah, and if Cuddy hadn't taken you off the case, you would have killed her. You want to come over for Christmas dinner?
You're Jewish.
Yeah. Hanukkah dinner. What do you care? It's food. It's people.
No thanks.
Maybe I'll come to your place.
Your wife doesn't mind being alone at Christmas.
I'm a doctor. She's used to being alone. I don't want to talk about it.
Neither do I.
You did good with the nun. Congratulations.
Thank you.
Merry Christmas, Dr. House. Dr. Wilson.
Good night. That was sweet.
Cat got your tongue? Nah, you killed the cat. Cut off his head.
I need to take a look at this.
Mom? 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 It's okay.
Just a couple of questions before I can authorize extending her disability benefits.
I don't like her. She's fat.
I could lose a little weight.
You alright?
Actually, before she signs,
I killed the cat. Lots of blood.
It's okay.
I have a couple of questions about some of these dates. The first diagnosis,
Schizophrenia. Dr. Walters, May 11 last year. The letter's in the medical file.
and April 6th, that was the last day she worked, but she received unemployment benefits for that week.
We fixed that. I know we did. We returned the money. That's the canceled check. Not the old one, you know, it's a copy.
And you're the dependent.
No. That's my little brother. I'm 18, just helping out.
You're all set. Just need a signature.
Hey, I'm talking to you. The cat's first. Now it's your turn, please.
Shut up!
It's okay. She just needs a little water. So
I'll go get it.
just hold on, okay? Just when she comes back, sign it. We're gonna be done. We just need this, okay? Please. Okay. The voices aren't real.
Caucasian woman, status post-respiratory arrest in the field, intubated, oxygenating poorly.
Dr. Gregory House, you call Dr. Cuddy at extension 3731.
This is a good hospital?
Depends what you mean by good. I like these chairs.
How is she?
Stable. Okay. Your mom had a small pulmonary embolism. Blood clot that got stuck in her lungs. Blocked the oxygen.
But the pain started in her leg.
Where the clot started, her calf. That's called a deep vein thrombosis. Basically a bigger clot.
It never hurt there before. I would have
A
noticed.
piece of that broke off, went up the vein through her heart and blocked the blood flow to her lungs. No blood flow, no oxygen. Is your dad here? I have some things I need to talk to him about.
My dad's running a little late. He's dead. Just talk to me. I take care of him.
All right. Your mom's blood alcohol was 0.12, 10:30 in the morning.
I gave it to her. 2 ounces of vodka. It cools her out. But that's first since Monday. That was 3 days ago. I've been real careful. She hears voices.
She's schizophrenic. Explains the DVT. The alcohol makes her pass out. She's immobile for long periods of time.
That doesn't happen. She's not an alcoholic.
She only drinks when you give it to her. We put her on blood thinners. You can probably take her home tomorrow.
It's not the alcohol. It's got to be something else.
Of course it's the alcohol. Hello. This guy's a professional doctor. Plays golf and everything, I bet. He's not going to tell you your mom's an alcoholic without proof. I'm sure he scoped the varices, checked her esophagus, ran all kinds of blood tests. Doctors like this don't make assumptions. They do the work.
I'd be happy to refer you the case, Dr. House. You seem so interested.
What case? It's over. Sending her home. How old is she? You're a doctor? On my own stethoscope. Did I ask you how old she was? I forget. A 38-year-old woman with no previous symptoms or history presents with deep vein thrombosis. How did she get it?
Oral contraceptives, smoking, diabetes, obesity, and what's the point here? A DVT is a DVT. Put on IV heparin to prevent future clots in it. What's the big mystery?
Fine. We're all sleepy. You need a clue. She's 38 years old. She's 20 years too young to get a deep vein thrombosis.
I treated a 12-year-old girl once, a soccer player. She got kicked in the leg.
There was no trauma, none of the risk factors.
You took a history.
I have some notes. They're not mine, but reliable, I think, for the purposes of this discussion. As for the immobility, well, she's real active right now, of course. Paranoia keeps her living.
Paranoia?
Oh, yeah, she's schizophrenic. But her kid wrote this, so it might be a little biased. Now, having to take care of his nutso mom and all. You think there's a connection? Do we include schizophrenia in the differential for DVT? Well, the answer is no. Abnormal dopaminergic pathways in the brain do not cause blood clots. Schizophrenia is not the cause of DVT. On the other hand, we don't really know anything about schizophrenia, so maybe it is connected.
Well, schizophrenia explains one mystery, why you're so fascinated by a woman with a bump in her leg. Like Picasso deciding to whitewash a fence.
Thanks, I'm more Leroy Neiman, man. And it is only about the DVT. She's 38 years old.
Well, solve this one and you're on your way to Stockholm.
We don't even know how to treat it. Come on, fumigation of the vagina?
A little louder, I don't think everyone's heard
2,000 years ago, that's how Galen treated schizophrenics. The Marcus Welby of ancient Greece.
Well, clearly you're not interested.
I'm interested. I'm interested in how voices in the head could be caused by malposition of the uterus.
Is there a better place for it?
And now what do we got? We got lobotomies, rubber wounds, electric shocks. My, that Galen was so primitive.
Where are you going?
I want to see the patient. An all-important human connection. Thought I'd give it a whirl.
You won't talk to patients because they lie. But if you're a patient with no concept of reality...
It wasn't for Socrates. That raving, untreated schizophrenic. We wouldn't have the Socratic method, the best way of teaching everything, apart from juggling chainsaws. Without Isaac Newton, we'd be floating on the ceiling.
Dodging a chainsaw is no doubt.
And that guitar player in that English band, he was great. You think I'm interested because of the schizophrenia?
Yeah, I'm pretty sure.
Galen was pretty sure about the fumigation thing. Pink Floyd. This is Dr. Gregory House. Nice to meet you. It'd be all right if we spoke alone for a while.
Oh.
Well, you're going to need me to... I got your case notes, doctor. There's a cafeteria downstairs. Get yourself whatever you want, as long as there's enough left over for a Reuben sandwich, dry, no fries, hold the pickles. Should run you about $5.80 with tax. I'll pay you when we're done.
No. Pickles.
Nice kid. How much do you really drink?
He's really talking to a patient? I don't know who I am anymore.
It's a blood clot. What's so fascinating about that?
He likes crazy people. Likes the way they think.
They think badly. That's the definition of crazy. Why would he like...
They're not boring. He likes that.
And the meds?
Baseball. I like baseball.
Very nice.
Very sad. My boy and me, we went to see a game.
Not Mets. Meds. Medicine. You take what he tells you to take.
No one believes me.
I do.
I thought he liked rationality.
He likes puzzles.
patients are puzzles.
You don't think so?
I think they're people.
Yeah, well, he hates them, and he's fascinated by them. Tell me you can't relate to that sentiment.
Told Luke it never hurt before.
Just rough. We didn't hurt.
Didn't.
Don't lie to him, Libby. Lively Lucy never lies to Lucas. Look what I do to him.
Learn anything from the human connection?
Yeah, the Mets suck. Also, for the last 2 months, she hasn't shaved her legs. Because of the tremors, she cuts herself.
The tremor's on you. She must always cut herself.
Exactly. Something changed in the last 2 months. I'm thinking the amount of blood when she cut herself. So let's start with some blood work. Collect and send for clotting studies, PT, PTT, factor V, protein CNS, the whole shebang.
Good luck. No pickles, and it's cold now.
If it's a Reuben, that's the way he likes it.
Everyone, this is Luke.
Also, Cameron, it's nice to finally meet you.
Yeah, say that we're busy. Luke, give us another half hour with your mom. We need to do some tests. Nice kid. Take her off the psych meds. That way we'll know what's what on the physical side. Who knows, we might get more out of her. Don't worry, no pickles.
Happy birthday.
Hey, who's?
I was going through your mail and there was on a form. Happy birthday.
No, no blood. Not mine.
For the test, Dr. House told you.
You're gonna steal it. Sell it. No. No blood. No. No blood. No. No blood.
Alcohol, 5 milligrams stack.
No. 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 Oh, no. Oh. No. Oh. Oh.
Well, good news. The lab says it's not strep, so we're done.
Wait a second.
No, really, not strep. Boys in the lab, sure, they're hard drinkers, but they're pros, you know. Plus, your kid actually has none of the symptoms for strep. I just figured it was quicker running the test than arguing with you. My point is, go.
I just wanted to ask your opinion, doctor. She's having a birthday party next week, and she's upset that I'm getting a sugarless cake.
The other kids hate it.
This is why you're here.
Sugar is the leading cause of obesity in America.
You want a doctor to scare her about the dangers of sugar.
She needs to get her weight under control.
Well, you know, I feel sorry for those other kids, Wendy, who don't have a mom like yours, a mom who knows that sugar causes heart disease, appendicitis, and athlete's foot.
Well, that's not fair.
Oh, yes, it is. No, I get it. You want her to slim down a little so she can wear pretty clothes like yours. Love the bracelets. Hey, what about matching outfits? You could be twins. Oh, she can't be your daughter. It's impossible. You look way too young. Happy birthday. Give the kid a damn ice cream cake.
You drugged her.
Actually, I didn't. I've taken her off all medication.
Your guy Foreman gave her Haldo.
We needed blood for tests. I assume that was the only way to get it.
He knocked her out.
Look, I have a cane and I know how to use it.
I hired you. You work for me.
Okay. Can I go now, boss?
The Haldol changes her. She says it makes her soul numb. Don't give it to her. If there be rags enough, he will know her name and be well pleased remembering it. You okay?
Old days.
For in the old days, though she had young men's praise and old men's blame, among the poor both old and young gave her praise.
So when I said no psych meds, I'm just curious, which word didn't you understand?
The Haldol had nothing to do with the bleed. You know that. I used it purely as a chemical restraint.
Oh, great. Well, that's good to hear. So she won't experience any of those pesky little side effects you get when your motives aren't pure. Oh,
Those side effects are so rare.
passing out, increased confusion, depression, that's not going to happen. That's not going to screw up our diagnosis because you just used it to restrain her. I'm so relieved.
She spit in my face.
It's so frightening for you.
What was I supposed to do? Tie her down?
Yeah, anything but give her drugs. That's basically my point.
The clotting studies. Pretty fast. You promised to take the entire lab?
Well, I saved up for emergencies. I told him she'd let out 2 units, and if it happened again, she'd die.
If it had happened at home, she would have died. The ER doc? He was going to send her home.
It turns out your best judgment is not good enough. Here's an idea. Next time, use mine.
I think they're choosing a movie.
Why did the patient bleed out?
The clotting study is so far normal.
Well, cover your ears. You don't want me to spoil the ending. Everything was normal, except for prolonged PT time, which means what?
Usually it means whoever drew the blood didn't do it right.
Oh, that's right, because you drew the blood. But you were precise, because you knew the tube was purely for the PT study.
That's right.
I'm right with you. I trust this result. For 2 reasons. A, because you are a good doctor. And B, because 5 milligrams of IV Haldol makes for a spectacularly cooperative patient. The prolonged PT time makes me think she's got a vitamin K deficiency.
Vitamin K would explain the bleed, but not the clot.
Without vitamin K, protein C doesn't work. Without protein C, she clots. Clotting and thinning all at the same time.
What about another drug interacting with heparin? An antibiotic like ampicillin? That would cause
Clever,
bleed.
but she's not on ampicillin,
2 months ago, she complained of a sore throat, and he got her ampicillin.
which she refused to take.
He just said she didn't take it. What is it? Everybody lies except for schizophrenics and their children?
It's more likely than malnourishment. Why not scurvy or like...
Gee, I wish my idea was as cool and with it as yours. What is yours, by the way? Do you have one?
alcohol? Simple. It causes immobility, which explains the DVT. It also causes cirrhosis, which explains the bleed and the prolonged PT time. Let's ultrasound the liver.
3 theories. Check out her place for ampicillin and diet, then ultrasound her liver. Let's find out who's right before she bleeds to death.
One. So Hal says the kid's sensitive. Thinks he takes good care of her. If we don't find anything, why let him know we did it in the first place? What's the point? Why not just make old Foreman lift the key from the kid's backpack? Looks like Luke sleeps in the living room. Nothing in there. He lays out our clothes. Enough organization, enough lists. I think we can control the uncontrollable. Fix her meds, fix her clothes. Maybe you can even fix her. Pick that up on your psych rotation.
Try fluoperazine, Thorazine, Clozaril. Tried everything. The ampicillin. Never touched it.
There goes Cameron's theory. God, I hope it's not a vitamin K deficiency.
And breakfast, lunch, and dinner. House was right.
That's the only thing she'll eat.
Yeah. Problem is, you can't actually live on this stuff.
I checked it out. I looked on the box. All the nutritional values are solid. There's plenty of protein and calories.
Yeah, vitamin A and C, but no K. That's why your mom got sick.
So what's the plan?
Load her up with vitamin K.
That's it?
It all checks out. You take her home in a couple of days. Feel like you're upset about something. You're gonna open up to me now, aren't you?
It's all my fault.
Here we go. Okay, I'm gonna say this once. You had done a very good job taking care of your mother. If this was all she'd eat, then what else could you do? Gosh, just being a kid is a full-time job.
Shut up! I'm 18. I should be able to take care of my mom. I almost killed her.
Good example. Just the time it takes to express those ridiculous, self-centered teenage ideas. I don't envy your schedule. No pickles.
My mom doesn't like them either.
Smart woman.
Before she got sick, I didn't like how bossy she was. Always telling me what to do, the right way to do it. Never thought I missed that.
Should get that looked at.
I still don't buy a vitamin K deficiency.
House was right. That usually makes you happy. Less work for us.
The kid feeds his mum a steady diet of booze, and the problem is too many burgers.
The kid's in a tough situation. You do what you gotta do to survive.
Feeding alcohol to an alcoholic is not a survival technique.
Where I come from, if it works,
Yeah, right. I'm rich. I couldn't possibly understand what this kid is going through. Just because you're drinking pricier stuff doesn't mean you don't have a problem.
you seen someone stagger down there, bro?
No way vitamin K's the whole story.
It's not broken. See this right here? It's the epiphyseal plate, otherwise known as the growth plate.
What's wrong with it?
Amazing thing, Miss Bond. You know how to read it. It can tell you how old someone really is. Exactly how old.
Great.
Not even 15. Almost, though. 2 weeks away. Maybe a month.
Last week. I was 15 last week.
Happy birthday to both of us. If you're gonna lie, though, go big. Go 21. That way you won't need your crazy mom to help you buy vodka.
Great. Thanks for the tip. Now, when I bring my mom home, is there anything I need to know about taking care of her?
I suppose your biggest worry is the booze. You're 15. Basically no mom. Child welfare let kids get away with that. Well, they would need those nice foster homes, and that would make them sad.
They'd put her someplace too. My life is working.
Not the word I'd use. Most 15-year-old kids are doing what they're supposed to be doing. You know, they're huffing glue, catching crabs.
If you turn me in, I'll sue you. That's privileged information.
Don't relax. It's not even your x-ray.
She's awfully calm.
How smart you all is.
There's a little bit of scarring, not much. Not enough to be.
Cirrhosis. But she doesn't drink.
Congratulations, you win. Actually, no one wins.
Is she cystic?
Solid mass. Cancer.
Vitamin K caused the DVT and aggravated the liver. But the tumor's the real reason for the bleed. The tumor's the problem. Mrs. Palmero, I'm Dr. Wilson. I'm afraid I have some bad news from your ultrasound.
It's big. 5.8 centimeters.
She do nothing. She dies from liver failure within 60 days.
She needs a transplant.
That's gonna happen.
She's 38 years old. She's a mother.
She's a schizophrenic mother. with no money, on the public dole, in fact, and he knocks back vodka every time a breeze blows her way.
Mickey Mantle had a whole bar named after him. He got a transplant.
Well, Lucy can't switch hit. Plan B, surgery to resect the tumor.
Joe Bergen does the gamma knife thing. Laser cauterizes while it cuts, saves more liver.
The tumor's way too big. He won't even consider it.
Not a big risk taker, Bergen. Only been drinking milk on his expiration date.
He has no discretion. 5.8 centimeters is past the surgical guidelines.
Will you do it at 4.6?
Why don't we just say it's 0, then we don't need them at all. Tumors grow, they don't shrink.
This one does.
95% ethanol. The ethanol dehydrates the tumor cells. Literally sucks them dry. Shrinks the tumor temporarily.
How temporarily?
Well, if we're lucky, just long enough to fool the surgeon.
Good morning, Dr. House.
Good morning, Dr. Cuddy. Love that outfit. Says I'm professional, but I'm still a woman. Actually, that sort of yells the second part.
Yeah, and your big cane is real subtle, too.
Gotta go. Those running noses aren't just gonna start walking on their own.
The clinic can wait.
How long? Maybe we could catch a movie.
You should know by now. My doctors have no secrets from me.
I don't believe it. Who came running to mommy?
It doesn't matter who. Point is, I know exactly what you did.
You have no idea what I'm talking about.
Somebody knows about a bad thing you did. That's a big field. But somebody you think might have told me, that narrows it down quite a bit. Someone who views me as a maternal authority figure. A young person, perhaps. How am I doing? Think I'm going to get there? Presumably hospital business. How many patients do you have?
She found out about my birthday, and I thought she told you, and I'd have to stand here and smile while you gave me a sweatshirt or a fruit basket. You know, made me feel that deep sense of belonging.
Actually, I was just going to remind you, you owe me 6 clinic hours this week.
Oops.
Hi, this is Dr. Cuddy. I need all the charts on Dr. House's current patients.
I've tried everything. Mm-hmm. Pulling the tongue, ice packs on the throat, hitting yourself, the groin pinch. Well, you've certainly covered all on normal medical bases. How are you hitting yourself, though? Is it an open hand or fist? Open hand. Well, that's how they teach it at Harvard Med. How hard? I'm sorry, I missed that. Could you do that again? That's very good. Hiccups.
I need to speak with you now.
Mm-hmm. Well, I need to go pee-pee. Just dial it up a notch and repeat. I'll be back. Girl in the boys' bathroom. Very dramatic. Must be very important what she has to say to me.
Yesterday, your patient's tumor was 5.8 centimeters. Today, it's 4.6. How does that happen?
I guess I'd say that Dr. House must be really, really good. Why am I wasting my hiccups? I wash before and after.
You also requisitioned 20 cc's of ethanol. What patient was that for? Or are you planning a party?
Do me a favor. I was going to say leave, but that works.
You shrunk the tumor.
Only way to get the guy
Fraud.
surgery.
Fraud was the only way. There's a reason that we have these guidelines.
To save lives, specifically doctors' lives, and not just their lives, but their lifestyles. Wouldn't want to operate on anyone really sick. They might die and spoil our stats.
Bergen has a right to know what he is operating on.
True. I got all focused on her right to live and forgot you do what you think is right.
You really didn't know?
No, I didn't. frankly, I'm angry. Which I'm guessing is the correct response. Of course, I'll know better once you tell me what you're talking about.
Your birthday.
Anger was a bad guess. Well, normally I'd put on a festive hat and celebrate the fact that the Earth has circled the sun one more time. I really didn't think it was going to make it this year, but darn it if it wasn't a little planet that could all over again.
It's a birthday. It's an excuse to be happy. You think that's lame?
Why are you here? Find me a pony?
I'm just waiting for the surgery.
Yeah, well, go scrub in.
All right, done. Close her up. Tina didn't just walk itself into a bar and let her out a double shot. Someone shrunk it down.
Sorry, I was very, very wrong.
House is lucky. I didn't just close her up. He tries it again. That's what happens.
I'll pass it on.
It looks like the surgeon got it all, but she's going to have some chemotherapy.
What kind is it?
Luke, stop running. If you stop for a second, it's not all going to fall apart. Give yourself a break once in a while. The fact is, your mum's going to have an extra drink every now and then.
No, she won't. She doesn't.
Fine. There are some things you just can't fix, that's all I'm saying.
That's how you'd handle it, something like this. You just give up.
No. Do it just like you. It's an infusion. She's going to have a drain in her abdomen. You're going to have to check for a possible infection.
Lucas Palmero, Trina Wyatt, Child Services, State of New Jersey.
Can I help you? This is a private room.
He's only 15 years old, a minor. He's in a tough living situation. We're just here to help.
I don't need your help.
15?
Lucas, you're going to have to come with us right now.
Where are you taking it?
Until the determination is made, he'll be housed at Children's Services.
I don't want to be housed. I live with my mom.
Not for the next few days. Come on. Let's not make this difficult, huh?
No. Mom. Love you.
The man's lost. Remember.
Yeah. I remember.
I love you.
Cuddy didn't say anything about pushing Bergen to finish the surgery?
Not a word. Some kind of mind game. He's waiting for me to crack.
Oh, either that or she's just being nice.
Yeah, right.
You said you wouldn't call. You're a real bastard, you know.
Yeah. I get that a lot. I don't think Mom's crazy. For in the old days, though she had young men's praise and old men's blame, among the poor, both old and young, gave her praise. You called social services. It was you.
No.
It's okay, it's okay. I get it. He'll have an easier time dealing with the system. Sure, he won't be with his real mother, but his real mother's sick. Someone needs to take care of him.
I'm not gonna live here.
What would his future have been? Taking you to chemo and back on the bus. Even if the cancer is in complete remission. You'll still have a mother who hears voices.
Talk no more. Talk no more.
Look what I do to him, Limpy. You said that. I checked the phone records. Only one call from this room. Smart. Charge you $2 a call. It was to social services, state of New Jersey. You're his mother. Couldn't do it to him anymore. Good for you.
Schizophrenics can make rational decisions.
On the small stuff, yeah. When to sleep, what to drink. You know, no lemonade, but I'll take some hemlock if you got it.
You're not Socrates.
Giving up your son because it's better for him is so sane, so rational. Self-sacrifice is not a symptom of schizophrenia. It excludes the diagnosis.
She's not schizophrenic?
She's 36 years old when she first presents.
It's a little late, but within the parameters.
The internist sends it to a shrink. One shrink sends it to the next. Tells them all she's not crazy. Drugs don't work. Why would they if she's not a head case? She got clearer when I took her off the psych meds. You think I'm crazy?
Well, yeah, but that's not the problem. Didn't you just leave your office?
I like to walk. Is that Dr. Jeffrey Walters? Hi, my name is Greg House. I'm a doctor. Oh, is that the time? I'm sorry, my watch must have stopped. Listen, you treated a patient about 18 months ago, a woman named Lucille Palmero. I wondered if you recalled running any tests at all. Oh, how terribly foolish of me, Doctor. Is it that late? I'm calling from London, you see. Must have got my times mixed up. So I have a headache. It's my only symptom. I go to see 3 doctors. The neurologist tells me it's an aneurysm. The immunologist says I got hay fever. The intensivist can't be bothered. Sends me to a shrink. He tells me that I'm punishing myself because I want to sleep with my mommy.
Maybe you're just not getting enough sleep.
Pick your specialist. You pick your disease. If it's not schizophrenia, what else presents with psych symptoms?
Porphyria.
Madison King Joe.
Think about that copper thing. What's it called? It's genetic. The body accumulates too much copper.
Oh, Wilson's disease?
Yeah.
Very rare. Nice. I like it.
If any of us did this, should fire us.
Well, that's funny. That's why I encouraged you to question.
You're not questioning. You're hoping. You want it to be Wilson's. Boom. Give her a couple of drugs. She's okay.
July 17. Appointment with a Dr.
She
Karn.
didn't keep it. She never kept another appointment with a shrink he made after that.
Karn is not a shrink. I looked him up. He's an ophthalmologist. Why would you want her eyes checked?
Wilson's presents with cataracts, I think.
Yes, it does. It also causes slight cirrhosis, which Dr. Chase so eagerly attributed to alcohol. So what are we still doing here? Lucy. I don't think you're crazy.
Neither do I. I'm crazy.
Come on.
Put your hands on the body and your chin in here. Thank you.
You're gonna see a bright light, okay? Your body might be accumulating too much copper. If it is, this should help us see something called Kaiser-Fleischer rings. Copper-colored circles around your corneas. Wow. I guess we should start treating her for Wilson's.
That's what I do.
I will talk no more of books or the long war, but walk by the dry thorn until I have found some beggar sheltering from the wind, and there manage the talk until her name come round. If there be rags enough, he will know her name, and be well pleased remembering it. For in the old days, though she had young men's praise and old men's blame, among the poor both old and young gave her praise.
Hi, Miss O'Mara. Ready to go home?
Almost.
Mom?
How are you?
I'm good. Oh, you really need a haircut. Dr. House. Luke, you're making Dr. House wait.
That's okay. We're just here for the music.
Luke, come on. I'm being discharged.
I heard a rumor.
Thank God I had cancer, huh? It's terrible having everybody think you're nuts.
Really?
I called to thank you. Did you get my message?
Yes. You're welcome.
Never thanking you. You turned me in. I told you we were doing okay. It's none of your business.
Look, I don't care how you were living. I just wanted you out of my life. That's why I had Dr. Cuddy call social services.
You okay?
You were right. It wasn't the DVT. It was the schizophrenia.
I know.
She's not nearly as interesting anymore.
Isn't it your birthday around there? So now the plan is either find ourselves a new counselor, stick it out with the old but go more often, or resign ourselves to the fact she's never going to be happy no matter what I do. So let's just take the money we're wasting and put it towards membership at Lakeview, huh?
Guessing the last option gets me formally presented.
Yeah. Geez, what's with you? Usually might ask me to stay today.
You a lot of sleep last night.
How things in the lease?
Great.
Great.
Yeah.
Until answers you're out of breath, you're lying to me.
Yeah. We got our moments. We usually work out. I need some water.
Yeah. That's how you work things out.
Talk. Someone apologizes. Man, I should have drank last night.
Hey, you mean you apologize?
Yeah, I guess.
How often do you guys have sex?
I know.
You did it this morning? You did. You did it this morning. Yeah, that's why you can't stand up, huh? Come on.
Police.
Honey, dehydrated. Do we have anything with electrolytes?
Sleeping Beauty. Wake up. It's an emergency. Fridge is empty.
Come on.
Almost 4.
Elise. Sweetie.
Call Jacques. Tell him I'm not feeling well.
Saturday. Been to work in 3 days, remember?
Sorry, sweet.
Come on. You've been at that since Wednesday.
Leave me alone.
Come on. Sit up.
Oh, leave me alone.
Leave me alone!
I think there's something wrong with me. She's been averaging 18 hours sleep a day since her admission.
Clinical depression. Incredibly contagious. Every time I'm around one of them, I get blue.
It's not clinical depression.
Great. Got it all figured out. You don't need me.
3 ER doctors, 2 neurologists, and a radiologist have all figured out what it's not. We need to figure out what it is.
If the above-mentioned doctors were interested in my opinion, they would have asked for it.
None of them are willing to subject themselves to you.
No pain, no gain.
The blood work shows no signs of inflammation, and no one can figure out what's actually the cause of it. What?
Husband described her as being unusually irritable recently.
And?
I didn't realize it was possible for a woman to be unusually irritable.
Nice try, but you're a misanthrope, not a misogynist.
What's the first thing you ask a doctor who's referring a patient?
Are you questioning my ability to take a history? What's the primary...
Not why. Why?
Diseases don't have motives.
No, the doctors do. Why this patient? What interests you? Give me the chart.
Why?
I found your interest interesting. She's irritable, sleeping 18 hours a day.
What's interesting about that? Hypersomnia is usually accompanied by irritability in depressed patients.
True, but not relevant. She's not depressed.
Hello, she's sleeping 18 hours a day.
Fever. Clinical depression does not cause fever.
She's sick and depressed.
She's sick. God damn it, why didn't I think of that?
Yeah, that's what I meant.
Elevated sud rate indicates inflammation.
Hypersomnia and personality changes point toward the brain.
Not the spleen. Thank goodness we hired a neurologist. Brain symptoms. Could this be a brain problem?
No other systemic signs of inflammation. Probably not vasculitis.
What about parasites? Malaria, Chagas?
The patient's never been outside of the United States, especially with topics.
You mean she claims she's never been outside the US?
Very good.
Doesn't matter. Blood and CSF smears show no sign of parasites.
It has to be a tumor then.
A tumor sitting directly on top of the brainstem that 3 ER doctors, 2 neurologists, and a radiologist missed.
Partridge and a pear tree missed it too. Redo the blood work and get a new MRI with 2mm cuts through the mesodiencephalic. And check for evil stepmothers. This much sleep usually indicates poison apples. Anything else besides the shortness of breath?
Not really. It's actually just kind of a tightness.
You smoke?
No, never.
Exercise?
8 hours a day. I teach preschool.
Sounds fun.
Any history of heart disease in your family?
Not that I know of.
Take a deep breath. Been under a lot of stress lately.
No more than usual.
You're probably just a little anemic. I'm gonna do an EKG just to make sure.
Do I need to take this off?
No, you can just pull that down in front. Good Lord. Are those real?
Do they look real?
They look pretty damn good.
They were a present for my husband's 40th. I figured he'd enjoy them more than a sweater.
That's so sweet. I'm afraid the cause of your problem is staring us right in the face. Actually, I guess I'm the one doing the staring. Of course, I can't be sure. I like to consult a colleague. He's actually somewhat of an expert in these matters. Can I get a page on Dr. Wilson?
A tumor. We don't know.
We're checking just to be safe.
I already checked for that.
The previous MRI had a broader view.
Some tumors are almost impossible to see unless we know exactly where to look. That means it would be small, right? Yeah.
Then you'll be able to operate. Take it out. If it's a tumor, there are a variety of treatment options, but there are variables other than just size.
Don't worry. Too late. Try to remain as still as possible. The less distortion there is, the more detail we'll be able to see.
Well, that's what breasts look like. It's a lie, a lie. If everybody knows it's a lie. Well, the tree pretends to fall in the forest. House, come on, they're breasts. They're a birthday present, not a philosophical treatise. Lie number one. She did not do that for her husband. She did that for herself. She thinks if she looks different, she'll be different. No, she thinks if she looks different, she'll be more attractive, which I have to say, not to her husband. Cosmetic surgery, so everyone else will look at us differently. Same reason you're wearing that tie. Well, exactly. That was going to be my next point. Last 3 months, same 5 ties. Thursday should be that paisley thing. It's a gift from my wife. No, it's not. Julie hates green. You bought that yourself. You want to look pretty at work. Wilson's got a girlfriend. Just stop. I don't.
It takes 2 department heads to treat shortness of breath. What do the complications increase exponentially with cup size?
I want an EKG and blood test, including tox screen on Mrs. Exam Room 1.
They're ordering tests to cover your luxury. Interesting.
Very tricky case. You love everybody. It's your pathology. There were no lesions and no mass effect that we could see.
What does that mean?
It means we're still not sure what's causing the neurological problems.
I know. Some things are hard to cure. But what I just don't get is why it's taking so long to figure out what's wrong with her.
I know you're scared. I would be too. I don't feel it.
You feeling nauseous?
Honey, you're right.
You see me? Get on the side. I need the Ativan. Okay.
What's happened?
Having a seizure.
She's aspirating.
Come on, Elise.
The MRI reveals nothing
That we were able to detect.
It's not a tumor.
A small glioma could hide from contrast. We could do a PET scan. Yes, that's how a responsible doctor would waste his time in this situation. Suddenly test and radiologists aren't capable of that. A glioma not presenting on a contrast MRI would have to be smaller than a grain of sand, which does not a gravely ill person make.
It could be just post-ictal disorientation.
We would have seen improvement by now.
Late-stage Lyme disease can cause seizures.
Does the husband care about her?
He hasn't left her bedside.
Boy. It also means she doesn't have Lyme disease. What, love conquers all? Lyme disease initially presents with a rash. Mr. Clingy would notice. We've looked at everything else.
Did you look at her breasts?
Man,
Could be paraneoplastic.
do you have any family history of breast cancer?
Her mother died of it.
The brain, but not the brain. Clever, huh?
How can breast cancer cause problems in the brain?
There are molecular similarities between brain cells and tumor cells. Paraneoplastic syndrome causes the body's own antibodies to get thrown off track. They end up attacking the brain instead of the tumor.
So, if you do find a tumor, what do?
We treat the underlying malignancy. Once there's no tumor to attack, there's nothing for the antibodies to get confused about.
If the tumor's treatable.
Exactly.
Ow! I'm sorry, I know it's uncomfortable. The tighter we go, the better the image will be.
You still keep me awake.
Don't worry, it's almost over.
I wish people would stop telling me not to worry.
I'm sorry.
My mom's the same age. I've been trying to get pregnant for over a year. Guess we're lucky we didn't.
A lot has changed since your mom died. Don't worry. Don't give up.
No tumor.
The MRI and the mammogram only showed a few benign calcifications.
It's most likely a small cell tumor. It's no surprise we're having trouble finding it. We should do a PET scan. Start with her lungs, then maybe her bones. Sometimes it presents with no tumor at all. How can a disease caused by a tumor present if there's no tumor? It happens. 12% of the cases.
And how do you treat it if there's no tumor?
You don't. Those 12%, no treatment. They were too busy looking for the tumor right till they put the patient in the ground. What choice do we have? Treat the symptoms. IV immunoglobulin. So you're just going to ignore the tumor? Eventually it'll get bigger. And it'll be really easy to find. One of you needs to check out where she works. Why? Because the husband's not sick.
Meaning?
If it's not paraneoplastic and it is a reaction to some sort of toxin, it's obviously not coming from their home.
Foreman, you do it. Why are you writing me? That's what I do. Has it got worse lately? Yeah, seems to me. Really? Well, that rules out the race thing. You were just as black last week.
How long has Elise worked here?
3 years. She's my best rôtisseur.
What's that?
The rôtisseur prepares the roasted meats and gravies.
How do you clean your grip?
La force du poignet. Say elbow grease.
You use chemical cleaners?
Ah non, absolument. Chefs don't do the cleaning anyway.
What about pesticides? You must spray for roaches and that sort of thing.
No, my kitchen is clean. No roaches. No, allez au travail. I need to get back to work.
The fact that I'm here asking you these questions, it doesn't worry you?
Look at me. I'm here 18 hours a day. That guy practically lives here. He does live here. I use the same detergents for 15 years and everyone is healthy as a horse. Whatever Elise has, she didn't get here. I don't hope she feels better. And I had to get a new rôtisseur.
Where's Ed? He went down to the gift shop to buy a shirt. I told him I'd stay up here just in case he woke up.
You must have better things to do.
I sent my laundry out.
You're not married.
No.
Praying for the perfect guy.
Let me guess. You've already found him.
You threw my towels out the window. That's all he meant. Freshman year, I came to a party that my roommate and I threw. He spent most of the night on the bathroom floor. He figured I wouldn't notice the vomit on the towels if I didn't have any towels.
I'm assuming he came back the next day to apologize?
No way. I would track him down. Conflict resolution has never been one of Ed's strong point. Nobody's perfect, right?
I guess.
Oh, my neck hurts.
I've been in this bed for a really long time. You do the same test we did last night, okay? Do you know what day it is?
My arm itches.
It's probably a mild skin irritation. I'll get you some hydrocortisone in a minute. Do you know what day it is?
Tuesday, it really itches.
How do I get you that cream right now?
Please calm down. Calm down.
this data.
You gave sedatives to a patient who's already sleeping 18 hours a day.
It was better than letting her scratch all the skin off her arms. Where's what else?
Creepy crawlies are consistent with paraneoplastic syndrome.
Onset immediately after IVIG isn't.
There is a simple explanation. Maybe she really has bugs under her skin. Infection? That's what a worsening of symptoms after immunotherapy would suggest. Blood cultures in the timeline rule out most bacteria. Patient throws up on your shoes. You clean up most of it. The symptoms rule out the rest. Serology rules out viruses. CSF smears rule out parasites. In the final stage of African trypanosomiasis, almost all the parasites are inside the brain. It's possible it wouldn't show on smears. But it's not possible for a patient who's never been to Africa to have African sleeping sickness. I'm just saying it fits the symptoms.
She could have got it from a transfusion.
Or I'm just saying she could have got it from a transfusion.
Which she never had.
Okay.
What about toxins?
No. The kitchen she works in is cleaner than some hospitals. But they do serve rabbit. Rabbit fever fits her symptoms.
Tularemia initially presents with a rash or ulcer near the infection site.
Now that she inhaled it, chopping the meat with a cleaver could easily aerosolize the bacteria.
No, then she'd have respiratory symptoms.
And she'd know it because she had a cold. Rejected Lyme disease. The couple would have noticed a rash, but a wet hacking cough is just going to slip right by. It's either that or she missed her exit on the turnpike and wound up in Africa. Okay, two lousy ideas. Unfortunately, they're better than all the other ideas. Tularemia. Bizarre. Very nice. That's why I write.
Did he just turn on the TV?
He needs to think. So this should tell us whether or not she's got rabbit fever.
For diagnosis of tularemia, you need a 4-fold increase in serum antibody levels. To measure an increase in either before, all we have is an after.
A single titer over 160 would be a big clue.
That's why I ride you. What does that mean? Even when I have a good idea, it's because of him?
Actually, I think he said your idea was a lousy idea.
It has to be one of these two conditions. I say we take our best guess and just start treatment, or treat both.
The treatment for tularemia can cause aplastic anemia.
How come he doesn't ride you guys?
He's got a crush on you. He just doesn't know how to show it.
You're over, he rides everybody.
And the treatment for sleeping sickness kills 1 in 10 patients.
So we start with the safer treatment.
By safer, you mean the one that's slightly less likely to kill her. Forming to have the gang tested for tularemia? Yep, probably inclusive, worth doing. So, what's her name? When do I get to meet her?
There's nobody. Give it up.
Your lips say no, your shoes say yes.
Well, they're French. You can't trust a word they say.
Solid, yet stylish. A professional woman would be impressed. I'm thinking accountant, actuary maybe. Somebody in the hospital. Patient? Chemo's not sexy. Daughter of the patient. She would certainly have the neediness you need.
I'm not going to date a patient's daughter.
Very ethical. Of course, most married men would say they don't date at all.
There was no date. I had lunch with one of the nurses. It's her first time in an oncology unit. She's having a tough time. Emotional.
Perfect.
I want it to be nice. That's all. I mean it.
You always do. It's part of your charm.
Hi, boys. Mrs. Campbell's test results. You remember her, the preschool teacher with the heart of silicone.
Nope, doesn't ring a bell.
They came in yesterday. I figured you guys would have been all over them. You know how concerned you were.
She's all upset because we paid more attention to the other girl. You check out her ass, I got the chest.
The tests were normal. Of course, that's just my opinion. I want to call a couple of guys from maintenance in for a consult.
You check her EKG results before she left the other day.
You ordered it.
You're the responsible one.
What's wrong? They look normal to me.
Where is she?
Waiting downstairs. Why?
That's right.
You have to get rid of the implants.
Surprisingly, no. But your EKG shows a slightly decreased heart rate.
Is that a problem?
You told me you hadn't changed your diet or exercise. Were you lying?
Lying?
Does your husband have high blood pressure?
My husband?
Yeah, see, if you're going to repeat everything I say, this conversation is going to take twice as long.
Yes, he was diagnosed 6 months ago.
You do a lot of cooking at home?
Not really, other than oatmeal in the morning.
Did you happen to notice a slightly odd taste to the oatmeal lately?
Wait, are you saying that
That it looks like your husband stirred in some of his blood pressure medication along with brown sugar?
you think my husband's trying to poison me?
No, nothing like that. He just doesn't want to have sex with you. Decreased sex drive is one of the most common side effects of the beta blockers he's been taking. I'm guessing he figured if you're both frigid, no harm, no foul, should have gotten in the sweater.
That's ridiculous.
Fine. If you're still concerned about the shortness of breath, start making your own breakfast.
Wait. What should I do?
If you care about your husband at all, I do the responsible thing. Buy yourself some condoms, go to a bar, find... Huh. Lab tests inconclusive.
Not surprisingly.
No, but too bad. Luckily, I have the answer. To what? Thanks for asking. The life itself, sex. Anything that can be transmitted via the blood can be transmitted through sex.
Sleeping sickness from sex?
It's not without precedent.
I'm pretty sure it is, unless you're talking about going to Africa and having sex with the tsetse fly.
A Portuguese man was diagnosed 3 years ago with CNS-affected sleeping sickness. His only connection with Africa was through a girlfriend who served with the military in Angola.
Boy, where'd you find that?
The journal, the Instituto de Higiene e Medicina Tropical. You don't read Portuguese?
You do?
Pretty sure that's what it said. Either that or it was an ad for sunglasses.
Her husband has never been to Africa either.
Oh, stymied again. Your logic is bulletproof.
I think ignoring respiratory symptoms is more likely than cheating.
Because?
They're completely devoted to each other.
Because?
They love each other.
Or?
They're overcompensating for guilt.
Find out which it is.
You want me to ask a man whose wife is about to die if he cheated on her?
No, I want you to be polite and let her die. Actually, I don't want you to ask her anything for me. Take the hostage, take the wife.
You don't trust me to do my job?
I'll formulate questions based on the answers we want here.
And how exactly do you reformulate have you screwed around?
Because you know she's been trying to get pregnant.
Yes.
After you got so freaked about the sick babies a while ago, I figured that was your thing. But you've never been prescribed folic acid. You can't lose a baby if you've never been pregnant.
You pulled my medical records?
You coughed the other day. I was concerned.
You were curious. Like an 8-year-old boy with a puzzle that's just a little too grown up for him to figure out.
Tomato, tomato.
So it's either sleeping sickness or this rabbit thing. They're both fatal without treatment. And unfortunately, the treatment for both is extremely dangerous. Other tests you can do? Not at this stage. But each condition has a unique history. We're hoping your answers to a few questions will help us. Sure. What do we need to know?
Before the sleeping problems, did you have any trouble breathing? The cough that wouldn't go away? Anything like that?
No.
You certain?
Absolutely. Never been away from her for more than a night. If she had breathing troubles, I would have noticed. The other condition is significantly more likely if you've had an affair.
Have you ever had an affair?
Of course not.
You sure?
I think I'd remember cheating on my wife.
You might be reluctant to admit it.
No.
I just want to be perfectly clear. If your wife has sleeping sickness, we don't treat her, she'll die.
I would never do that to Ed. I love him.
Absolutely not. I love her.
All right then. We say no cheating. We cross off sleeping sickness. Any new ideas? Okay, we go with Formis Tularia, starting to run IV chloramphenicol, 25 milligrams per kilogram 4 times a day. Good night.
Where's Ed? Right next to you. Well, you're 2 down, 2 to go. In 2 days? No, doses. We have about 20 more days of this fun. What time is it? About 4 a.m. I pulled the short straw. Flow rate looks good. Where's your flushing? What time is it? 4 a.m. Do you not remember just asking? I don't know. Elise? 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 Elise?
What are you doing?
Trying to wake her.
Did she fall asleep again?
In a seconds. Elise? Elise?
What's happening?
Patient's not responding. Pulse is fine. Airway's open. Check her blood pressure. Pupils are reactive.
Elise, wake up. You gotta wake up. What does that mean? What are you doing?
She's unresponsive to pain. Come on, Elise.
She died.
No. She's in a coma.
There's only one way a tularemia patient goes into a coma while on IV chloramphenicol.
The patient doesn't have tularemia.
And then there was one. Patient comes in because she's sleeping too much. It takes 10 doctors in a coma to diagnose sleeping sickness.
And then there was none. We still have the problem of explaining how a white chick from Jersey who's never traveled south of DC has African sleeping sickness.
The obvious explanation.
I made it clear. If this guy's lying about sleeping around, he knows he's murdering his wife.
Does seem unlikely. Go away.
What are you doing?
Checking for lymphadenopathy. I'm waiting for you.
Who are you?
I'm Dr. House. Your wife has human African trypanosomiasis. Sleeping sickness.
You mean it's not tularemia? A virus, tumor, or cancer?
No.
I've never had an affair.
I believe you.
And I trust Elise.
The treatment for this disease is a drug that's fatal on its own 10% of the time. Which is why I need your written consent before I can legally prescribe it.
Why would she lie if she knew it could kill her?
I don't ask why patients lie. I just assume they all do.
But why?
To protect you, because you didn't think it mattered. It just seemed easier because that's what people do. If you're absolutely certain that your wife has never had sex with anyone but you since you were married, then I'm wrong. But if you think there's a possibility that just one time she wasn't perfect, one weekend you're out of town, one fight where she ran to a friend, one stupid Christmas party, then you need to allow me to start treatment. Because if we don't, she's going to be dead by tomorrow morning. You trust your wife that much?
I don't know.
I'll start the treatment.
Glass syringes?
The special IV tubing.
Why do you do stuff?
Because Milastopol melts plastic. The stuff's basically arsenic mixed with antifreeze.
It doesn't kill us, makes us stronger, huh?
Nietzsche wouldn't have been so glib if he'd been prescribed Milastopol.
Can cause vomiting, abdominal pain, blood toxicity, neural damage, cardiac arrhythmia.
I forgot to say it's gonna hurt like all hell.
She's lucky she's in a coma.
Long before we know if it's working.
It's tough to say. It's a good sign that she hasn't gotten any worse.
Does she even know I'm here?
She knows you're always there for her.
Yeah. If she gets better, it means she wasn't always there for me.
It means she made a mistake.
I can't help it. Part of me, big part of me, can't handle that. Doesn't want her to get better. Does that make me a terrible person?
Yes.
So you're treating her for African sleeping sickness because you don't think it's possible for someone to be faithful in a relationship?
And you do?
Yes.
And you need to tell me that.
Look, I'm not having an affair. I had lunch with someone I work with at work once.
I believe it. What I don't believe is it would be just once.
I love my wife.
You certainly love saying it. I'm sorry, I know you love your wife. You loved all your wives. Probably still do. In fact, you probably love all the women you loved who weren't your wife.
You can be a real jerk sometimes, you know?
Yeah, and you're the good guy.
At least I try.
As long as you're trying to be good, you do whatever you want.
And as long as you're not trying, you can say whatever you want.
So between us, we can do it. We can rule the world. Mixing up some margaritas. Mine's a double senorita. That's Portuguese, you know.
Spanish.
Uh-oh. What's going on?
I'm recalibrating the centrifuge.
Turn around. It's a very sad thing. An uncalibrated centrifuge makes me cry too.
I'm not crying.
Okay.
I told the husband he was a jerk.
Why?
When I was in college, I fell in love. I got married. And
At age, the chances of marriage lasting.
it lasted 6 months. Thyroid cancer metastasized to his brain. There was nothing they could do. I was 21 and I watched my husband die.
I'm sorry. But that's not the whole story. It's a symptom, that's your illness. thyroid cancer would have been diagnosed at least a year before his death. You knew he was dying and you married him. Must have been when you first met him. And you married him anyway. You can't be that good a person and well-adjusted.
Why?
So you wind up crying over centrifuges.
Or hating people?
The fever spiked to 104. Echo shows global hyperkinesis. Blood pressure, barely 90/40. Dopamine started 270 micrograms per minute 10 minutes ago. Still no change. Killing the parasites isn't going to do much good if we kill a heart at the same time.
The heart can be replaced, the brain can't.
And right now we're killing both. If she's going to die, we should at least let her do it without that acid flying through her veins.
What's happening? We would have expected your wife's condition to show some improvement by now. It hasn't. It's going the other way.
Die.
He's away.
It's just going to be okay.
Yeah, sure. What are you gonna do? Were you always honest with her? Do you know how lucky you are? Your wife is alive. She loves you.
But she did. And love a person and do that too.
She loves you.
I need to know who you had the affair with. He has to be notified so we can get treatment as well. Why did you lie to us? You knew your life was at stake.
He's not coming back, is he?
We all make mistakes. And we all pay a price. I need that name.
Hey there. How you doing? Fine. Do you know where your dad is?
Can I help you?
You. Give me that.
What are you talking about?
Mrs. Miller, you found your lady?
I was just switching it to silent in case someone called.
No, you were cheating.
Please. Like I have to
Lady,
cheat.
I said, wait.
Sure. Plus.
I need to use the one room. The bathroom? Sure. In 19 minutes. Can't do it. You got a friend in the bathroom with the answers? Fine. I'll get you an escort. Don't sit up till I kill you. Don't stand up. Yes.
Hey, he's really sick.
Eyes on your work.
You all right? What is going on? Get some help.
The kid was just taking his AP calculus exam when all of a sudden he got nauseous and disoriented.
That's the way calculus presents.
Severe bradycardia. Heart rate's down to 48 and falling fast.
You know the kid?
No, it just came in.
Mom, real good looking.
I didn't notice.
Then it's a mystery. Not why he's sick, but why you care so much. Gift job's up and buy him a car.
He's not responding to atropine.
Boys love fart jokes. Find one with a good fart joke. He's a teenager. It's drugs. Tell those ER geniuses to give him charcoal and naloxone. Stop following me. His tox screen was negative. He's still whacked out. You don't care about the kid. You just find his illness in
His CAT scan was clean. There's no sign of an infection. It's not diabetes.
And you don't care about him. That's what you want to hear. Not the slightest. Me neither. This will be objective.
Maybe it's shigellosis.
Wouldn't account for the bradycardia.
Viral myocarditis.
Wouldn't account for the whacked out. So, what's the differential for negative tox screen? He was clean.
Well, someone screwed up the test.
That never happens.
Or he OD'd on something we didn't test for. 1,4-butane diet would give you these symptoms.
That's new. Copy machine toner. Same punch as GHB. A little pricier, way more dangerous. But on the other hand, it is legal. I want you to go to his house and find his stash. I'll bet you know all the good hiding spots.
Actually, I never did drugs.
Better go with him in case he gets high. How much atropine is the kid getting?
1 ml.
Make it 2. In case he needs his heart later on.
Matt, did you take any drugs this morning?
Sit down.
Can you squeeze my fingers for me? Did anyone give you anything to help with the math test? Matt?
I told you, he doesn't take drugs.
Miss Davis, all parents think that about their children. And they're usually wrong. I gave my mum a little trouble when I was his age. I turned out okay. Even she thought so.
I know my kid. The fact that you did drugs doesn't mean he did.
Did he go anywhere last night?
No. He was home studying.
Any friends come over to help him?
And bring him drugs? Is that what your friends did?
Miss Davis.
Look. I tested him myself. I'm a home kit. I took some hair off his brush. I didn't want him to know about it because I do trust him.
Then why did you test it?
All he did last night was study and argue about his college interviews. He wants to be himself. No haircut, ratty old clothes, that'll go over big. And we both gave up and went to bed, that's it.
Has he ever had any problems like this before? Any family history?
No. Just me and that.
Guys, staff.
Right, what's going on?
Give some precautions. It's easy. Calm down.
This room is way too clean for a teenage boy.
You know why House thinks I'm a druggie?
This is going to be a racial thing, isn't it?
Same reason he thinks this kid overdosed. When you're a drug addict, you want to believe everyone else is too.
He's not addicted. He has to take drugs.
The definition of an addict.
He's in pain.
And addicted to painkillers. What a coincidence.
You really never did any drugs?
Now this is going to be a racial thing.
Oh, deflecting a personal question with a joke. Gee, who do I know that does that?
Yeah, I'm just like him. Except for the angry, bitter, pompous cripple part.
Maybe we should all pitch in and get you a nice cane. You already have the matching gym shoes. Check this out! Mom's not too careful with the homemade tomato sauce.
The top sticks out like that. It's a sign of bacterial contamination.
This one's open.
I am extremely disappointed. I send you out for exciting and designer drugs. You come back with tomato sauce. Bet you paid twice as much. I got mine online. Matt decided to make himself a homemade pizza for a bedtime snack.
So there's botulism as well as a million other toxins that cause gastroenteritis, cardiac symptoms, and mental confusion.
I'm not so sure about gastroenteritis, but mental confusion. Bring it on.
Don't.
Delicious.
Did you have a death wish?
Notice you didn't try to save me. I figured you were trying to make some kind of subtle point. That was. The kid just started seizing, not a symptom of foodborne toxins. Also not a symptom of drug use, not 2 hours after admission. No, that would make him seize, in addition to all his other delightful symptoms.
Pesticide poisoning.
Carbamates, or organophosphates, organochlorines.
Inhalation or absorption?
Too soon to tell.
We should wash him down. The poison could still be on his skin.
Already told the nurses.
I feel good.
That's your complaint. Your major symptom.
I told her this was a waste of time.
I notice colors more. And music. I'm really hearing music. I'm 82, and I'm supposed to be playing canasta with the other old ladies, but now, when I see a guy with a cute butt, I can't stop looking at him. Or a sexy beard.
And you figure that enjoying cute butts is a sign of disease.
It all started a month ago when Mark rented Gone with the Wind for me, but it had the wrong DVD in it.
Oh, right. I forgot. This is all my fault.
Of course, he was too busy to bring it back.
Yeah, like I don't have a life.
So I watched it, and it had this actor in it, this kid called Ashton Kutcher. Now, I think about Ashton all the time. All the time. You remind me of him. Same bedroom eyes.
People are always mixing us up.
I suppose you need to check my heart.
No, that won't be necessary. I told you, but I am going to admit you to the hospital for tests.
What tests? She's just old.
You're just insufferable. Your mother has had a sudden personality change. She should be checked out. I'll have a nurse come in and admit her. Put your handsome to do paperwork.
He's been on this medication for over an hour.
Pralidoxime is very effective. It just takes a little time for it to kick in.
And maybe you're wrong. Maybe it's not a pesticide.
The blood work was pretty conclusive. It's an organophosphate.
Oh my God.
Miss Davis. We're at 30. Ready, cardiac arrest. Get me the pads.
What are you doing? You're going to beat his heart for him. Set it at 60.
I can't stand this anymore.
We'll keep him on the pads for another hour.
Then what?
Let's see what happens.
Well, that's not my philosophy. Especially when it comes to my son. And if something bad might happen, I'd like to know what our options are.
The pralidoxime isn't doing him any good. You're gonna have to wire his heart.
You're all wrong about the pesticides.
I ran his plasma again twice.
Are there any stronger treatments for the organophosphate poisoning?
Oh, damn it, you caught me. We went with the weak stuff. Just trying to save a little money. Actually, one of my professors at Columbia developed an experimental treatment for the Army.
What's the success rate?
They're targeting. There's a different hydrolase treatment for each poison. We need to know if Matt got hit with ornithine or malthion.
What's the success rate?
Excellent, I'm sure. The U.S. Army, be all you can be. Pointing is one of the kid's chances without it.
Minimal at best. The poison's broken the blood-brain barrier.
I assume minimal at best is your stiff upper lip British way of saying no chance in hell.
I'm Australian.
You put the Queen on your money. You're British. You call your professor.
If we don't know what kind of organophosphate we're targeting, we don't know which hydrolase to ask for. There's over 40 organophosphates.
I'll get all of them.
Great minds think alike.
By the time we get here, we better know which one we need. If we figure out how he got exposed, we'll figure out what he was exposed to. Well, Mom had homemade tomato sauce. Call me crazy, but I'm thinking maybe homemade tomatoes. Front yard vegetable garden.
Yeah.
Kids out there spraying. Sees a pretty girl. Hormones raging. Spray can goes off in his face.
I'll check into it.
I'll make the call.
I'll keep the kid alive. For a while at least.
I'll have lunch.
Superior vena cava. Into the right atrium. Tricuspid valve. Lodging into the wall. It's the right ventricle. Can you turn off the tap? Capturing.
Getting a native heart rate of 36.
And I went to, let's get him to 50.
The healer with his magic powers. I could rub his gentle brow for hours. His manly chest, his stubbled jaw. Everything about him leaves me raw.
Psych ward's upstairs.
With joy. Oh, house, your very name will never leave this girl the same. Not bad for an 82-year-old. She asked me to give that to her true love.
What can I say? Chicks with no teeth turn me on.
That's fairly disgusting.
And that's ageism.
You better watch yourself around this babe. Here are test results.
Impressive. Yeah.
I found the pesticide. It's diazolphoton. And it's Eddie. He used up the whole can.
Yeah, I'm getting chase on it.
The poison's called diazolphoton. This should bond with it and neutralize the poison. Then his nervous system will start sending the correct signals to the rest of his body.
But there was no diazol. Well, that stuff in that can.
The label says diazolphoton. I can show you.
But you didn't test it.
You said Matt sprayed with it this morning before school.
Matt started that garden himself for environmental science class. They weren't allowed to use pesticides.
Maybe he cheated a little.
It was orange peel oil, totally organic. He dumped that other stuff last winter.
The symptoms fit. There must have been some left in the can.
If you're wrong, what will this treatment do to him?
Well, theoretically, it could increase the toxicity but we're not wrong.
Don't.
We're not wrong.
I can't let you do this.
Get a court order. Unless you want to see someone killed by sheer irrationality.
Maternal instinct is always irrational. Doesn't mean it's wrong.
Actually, that's the definition.
It doesn't make her mentally incompetent.
She's risking her son's life based on a teenager's claim that he watched something. How mentally incompetent can you get?
That's a brilliant legal argument.
Listen, have your Harvard law dog whip up some high-grade legal-sounding psychobabble. Temporary insanity brought on by acute panic distress syndrome. I don't care. We have to get in the hydrolytics.
Her only sign of mental illness is that she disagrees with you. Some would consider that a sign of sanity.
Not the kid. Let's ask him. Oh no, I forgot. We can't. He's dying.
Get the mother to sign off that she's refusing this treatment.
Goodbye. I, Margot Davis, have been informed of the risks which may arise from my refusal to advise medical care. I hereby release.
Who are you?
I work for the hospital. The Princeton Plainsboro Teaching Hospital and its employees, agents, and otherwise for any adverse medical conditions resulting from my refusal. It's not the hospital's fault if my son kicks off.
Kicks off?
I punched up the language, mostly for clarification. I understand my doctors consider my decision to be completely idiotic,
Why are you doing this?
but I am convinced I know more than they do. I took a biology course in high school. I assume that's, yeah. Besides, I enjoy controlling every single aspect of my son's life, even if it means his death. Sign here, please. I brought a pen.
Who are you?
I'm the doctor who's trying to save your son. You're the mom who's letting him die. Clarification. It's a beautiful thing. She rethought her position. Start him on the hydrolase.
No, we've got a problem.
3, 1, 2, 3. Heart rate's 49. O2 stat, 84 and falling.
Saline, atropine, and diazepam now.
His name is G. Lane. He was admitted 12 minutes ago. Identical symptoms as Matt. Jesus isn't sure he's gonna make it.
Side. Matt's next door neighbor by any chance?
They live 10 miles apart. Apparently they don't even know each other.
We lived in an apartment. We have 2 bamboo trees. No pesticides. Just dry seaweed for fertilizer.
The second kid's heart is almost as weak as Matt's. We may need to get a wide up too. And I don't know how long Matt's brain will hold up. His heart's not pumping enough oxygen.
How much are you giving him?
80%.
Make it 90.
We're risking damage to his retina.
What the heck, do it anyway. He's a calculus student. Probably likes having a brain. I'll have Foreman take care of it.
I'm the primary.
Yeah, but the mom wants to get rid of you. You know me, I'm a people-pleasing kind of guy.
She complained? About me?
She went to the principal, told Cuddy you took drugs in high school. This is going to go on your permanent record.
I was trying to get information. It was a strategy.
She also used the word slacker. You want to come in, smoke a little weed, watch some MTV?
I suppose no idea what could have happened.
You sure that she didn't sneak out of Matt's tomato patch? Maybe they snipped disulphoton together to get high.
Same school, different grades, different cliques, different everything.
They managed to get poisoned together. They must have something in common.
Their classes aren't even in the same building. They don't even eat lunch in the same lunchroom.
How do they get to school?
Unless you're with the board, the police, or the union, I don't care who you are.
Sir, we need to test the bus for chemical residue.
And I need to pick up the basketball team. You got a problem with that? I'm my supervisor.
2 kids were poisoned on your bus this morning. They're dying.
My God, the things he said.
Dr. House wanted your son to get the medicine he needed. He was willing to do whatever it took to make that happen.
The wrong kind of medicine.
He didn't know that. At the time, it was our only choice.
He would have known if he had listened to me.
He listened. He just assumed you were wrong. To be honest, that's true of most of our patients.
You're just as pompous and superior as he is.
Matt is back row right. The Asian kid, first or second row left. Look, I got this rash in kind of my groin region.
It's not a symptom.
Neither is being obnoxious. Looks like you're really clear.
So who poisoned him?
We're not sure yet if it was done on purpose.
Oh, yeah? You ought to see these little bastards screaming and punching each other all day long.
Did you happen to notice if anyone was doing any spraying near the bus route?
Oh, yeah, there was this truck down by the pond doing something or other. It smelled kind of funny, too.
Oh, Dr. House.
Well, it took you long enough.
You're waiting here, Mr. Adams. Could you step outside for a moment?
Why?
Because you irritate me.
He is my son, Doctor. He's just a little cranky from not eating.
Fine. Mrs. Adams, have you had any recent sexual activity?
What?
Why? I don't suppose fantasies count.
Oh my God.
Unfortunately, I've hit kind of a dry spell. Only for the last, I don't know, 15 years.
She's confused. My father died 8 years ago, a heart attack.
Not in bed, dear. Why do you ask?
Because you have tested positive for syphilis.
That's impossible. And insulting.
I don't think it's the first time that Mom has heard this diagnosis.
Cupid's disease. That's what we used to call it.
When did you get it?
1939. Prom night, I think. He had a Chevrolet. It was before I met your father.
You said Dad was your first love.
He was. We're talking about sex. But I was treated.
Which suppressed it, in your case, for 60 years. But now it's back, and spirochetes that cause syphilis are eating away at your brain cells.
Oh, that's revolting.
It's not as revolting as chlamydia. It's got seepage. And it's the 21st century. You got flying cars, robot dogs, and penicillin. High-dose regimen for 2 weeks, you're cured.
I can't believe this.
Yeah, well, pinch yourself.
I guess for the next 2 weeks, I'd better practice safe sex.
You'll be fine. Just feed that cranky kid.
The county's worried about West Nile, so they sprayed ethyl parathion right next to the bus route.
You have the hydrolase for ethyl parathion?
Yeah, only one problem. That's mother faxes records to the CDC. She refuses to let us do anything until she hears back from them.
You're getting good at this godlike Dr. Ragged. Why don't you talk her out of this lunacy?
She's not really a big fan of mine.
Well, mine. Well, only one man left in the bullpen, and he throws like a girl.
I hate sports metaphors.
Give her the high, hard one.
We really think the hydrolase is the
I'm
only...
thinking about transferring that out of here.
Davis, your son is very sick. He won't survive a transfer.
I'm getting a second opinion from the Center for Disease Control.
Right. Look, when my grandmother got sick...
What? You're going to tell me some tough decision you had to make?
I know how hard this is for you.
Maybe embroider the story a little, make it fit.
Can't imagine being in your position.
Honesty, a kind of vulnerable honesty. That's your thing. And the looks. You send a single woman to hustle the single mom.
Actually, they sent a doctor to tell you that if your son doesn't get this treatment, there's a good chance he'll die.
That's what House said about a treatment that would have killed Nat. You've got to do better than that.
No. It's on you. You need to do better. Right now. Yes or no?
I don't know.
Figure it out.
Wait.
Guys, 10 milligrams. It's not responding. Another 10 milligrams.
You're killing him. You're killing him. Get out of here. Get out of here. Come on, ma'am.
Their hearts are barely pumping. Their lungs are shot. Now they're showing liver toxicity.
I guess Matt's mom won't nominate us for any Doctor of the Year awards.
Only explanation is they got poisoned by something besides ethyl parathioline. Then the hydrolyse would release the neurotoxins instead of bonding with them.
The only thing they have in common is the bus.
Except their symptoms. Given their severity, in fact, their cardiac symptoms are getting worse much faster than their other ones. What does that tell us?
The poison was probably absorbed through the skin.
They were admitted at 8:45 and 11. When were they poisoned?
Absorption through the skin, anywhere from 3 to 8 hours.
In case that died more like 1.5 to 4.
So Matt was poisoned before 7:15, before he got on the bus.
You're thinking each kid got poisoned in his own house? 2 separate exposures?
What do teenage boys do in the morning? Besides the obvious.
Wake up, go to the bathroom, and the obvious, then check their zits in the mirror.
Do they both use the same acne cream?
Because acne cream contains lanolin, which could have pesticides, and you're thinking they both bought the same product.
Contaminated. Shaving cream.
She doesn't look like he shaves.
He sweats.
Deodorant could contain lanolin.
Do these people have animals?
She has a dog, Matt has a cat.
Fleas, flea powder.
Okay. Go to their houses, check for anything that might have touched their skin between the time they got up and the time they went to school. I'm running low on tomato sauce.
Dr. House! Hello.
I sent you home.
I came back. I took a cab so my son wouldn't try to chaperone us this time.
I'm sorry, but the fact that the sexual pleasure center of your cerebral cortex has been overstimulated by spirochetes, it's a poor basis for a relationship. I learned that one the hard way.
Doctor, these feelings that I've been having, is it all because of the syphilis?
Yes.
Then here's the prescription you gave me. Well, it's not likely I'm going to infect anyone.
No. But it'll kill you.
Well, gotta go sometime, and I really don't want to play canasta for the rest of my life. I like feeling sexy again. I can fool out of myself with handsome young doctors.
Do you think that I would have given you this if it would stop you from flirting with me?
But if I'm cured,
Then all the spirochetes will die off. But the little pieces of your cerebral cortex that have been destroyed won't grow back. Your brain damaged. Doomed to feeling good for the rest of your life.
Right?
Georgia?
When I stop being contagious, I'll come by for a checkup.
Matt uses Sure.
She uses Old Spice.
No zit cream. What's your kid?
Floral air freshener.
Doesn't matter.
When was the last time you heard of a teenage boy using air freshener?
Her shampoo.
Johnson's over here. That's mom would make him use air freshener.
There are limits to a mother's power.
Even hers.
Just check.
Negative on the floral.
Matt's ALTs are up to 800. If they get any higher, we can toss his liver.
Yeah.
No matches on flea powder or underarm deodorant.
Any other kind of deodorant.
What about shampoo?
No to shampoo,
Bar soap, dish soap.
soap, dish detergent.
What about laundry detergent? Maybe they both
Wash their clothes this morning.
I'll check.
You know, if we cure Matt,
He can use his close brush with death on his college essays. Admission guys love that stuff.
That's how you got in, right? Jailhouse Diary.
TKO.
TKO. Liquid?
Liquid, 128 ounces.
128. Yellow jug. Special.
Environmentally safe formula.
It's the same.
Bring in the detergent.
So the detergent was contaminated with pesticides?
Which soaked into their clothes and absorbs into their skin. Hi. Listen, the clothes your son wore today, he washed them this morning, right?
What?
Nice, respectful Asian kid does the laundry.
你告诉他根本没有洗衣服啊。
My wife said he didn't.
Well, then I'm betting he washed them last night without you knowing.
他会不会晚上自己把衣服
He doesn't even know how to turn on the machine, and those clothes were new. Nobody washed them.
His clothes are all new.
The ones he wore today, yes, never washed.
Now what?
What about Matt's clothes? Were they new?
They're really old jeans, I think. They've been bagged and taken downstairs.
Davis.
Yeah, then that's. And they're old.
And yet the label isn't faded in the slightest. Fake old. $100 for the homeless look. What, kids aren't pretentious in England?
She was wearing a different brand. How could they both have been contaminated?
That is a question for the ages. Meantime, get these tested.
I never bother to wash new clothes before I wear them.
Right. Your wife does. She likes feeling nice and comfortable.
Hey, I'm a man. I don't have time for laundry. I'm saving lives here. No, she doesn't wash them either.
So your skin absorbs a little dye, the odd chemical here and there.
Well, you know me, Mr. Living on the Edge.
Judging by the self-importance of your strut, you have identified the chemical in question.
Phosphorus.
Hit him with the hydrolyzed.
She's parents said yes, but my mom said no.
She's gonna feel like $1 million when she lives and her son dies. Send Cameron. She's the only one who's managed to talk her through anything.
Not this time. Matt's mum won't make a move until she gets that opinion from the CDC.
Godot would be faster.
What is this?
Thought I'd hang out. In case you change your mind. I could give Matt the medicine right away. Don't worry, I've got time.
The CDC promised they'd call.
I'm sure they will. Maybe tomorrow, maybe the day after. It takes time to review fax records. And they'll probably tell you they can't make a decision based on fax records. This is Susie. She's never gonna marry him. The money.
What makes you think you're right this time?
Same reason as last time. If you want to see how the other kid does first, that's okay. I'd help you. Although there's a real good chance
What? Matt might kick off?
it's a little blunt. I was going to say run out of time or just kind of let my voice trail off.
Hello? Yes, this is Margot Davis. But you have his records. I sent them. Yes, I understand. They can't help me.
They haven't seen him.
I can't make a
Give it to
decision
him.
with it. The CDC is unable to get an opinion at this time, man. We're going to have a doctor in your area next week.
You fooled her with that.
House.
So I'm going to be cured?
As long as you don't wear any more poison pants.
I'm sorry, Mom. I knew the pants were stolen. They were only $5. You're gonna be hell, aren't you?
Oh, honey, I'm just glad you're alive. Let's get you home so you can rest. Maybe I am too hard on you. You don't have to make up that test till next week. You could stay in bed and work on your applications.
Some guy was selling pants out the back of his truck near the school. When he wasn't busy as a clothing entrepreneur, he did day labor at a cornfield on Route 1. He used the same truck for both jobs.
So he spilled pesticide on the pants, was too lazy to clean up. The real question is, why are you still here? Why aren't you out there making up with the joyful mother?
Why would I do that?
No reason at all. You don't care about her or her son.
Oh, Dr. House. The CDC called. Again.
Oops.
Who are those guys?
Oh, they're the arrogant jerks that saved your life. nice room.
Yeah, it sounds thick. Too bad he's not coming.
Look, I talked to him myself. He'll be here.
Right.
You're the one who said that the song could use a hornpipe, so I got the best, John Henry.
You think I'm stupid?
Of course I do. That's not the point. He'll be here, okay?
Take a left up there.
South Street. I canceled this gig. You said you didn't want to do any sessions for a while.
Wow. I called her out and canceled it.
Are you up to it?
Let's find out.
You lied to me. John Henry is never gonna show up.
Will you stop?
It's been like 2 hours.
And we will keep waiting. I mean, you've heard this guy play and you know what he does. So can you just shut up, Tommy?
Oh my God.
Am I late?
You need to hear it again?
Nope, I get it. Let's try one. See what we get. Let's do it.
I want in.
John Henry Giles, you're a fan of his music?
He's a musician. That paralysis thing. Guy can't walk for 2 years. Nobody knows why. It seems mildly interesting.
Forget his paralysis.
Tell that to the rest of his bowling team.
As far as this hospital is concerned, this is a simple case of low-bar pneumonia. Boring.
But that not walking thing, that could turn into something serious.
Marty Hamilton is his primary physician out in California. He's dealing with the paralysis.
Know all about it. Multiple treatments, multiple surgeries, making real progress. Fixed everything but the legs.
Dr. Hamilton already called and asked for your team. And by team, I don't mean you.
Like I always say, there's no I in team. There's a me, though, if you jumble it up.
Foreman did his residency with Hamilton.
I know. I accidentally glanced at his resume before I hired him.
He wants someone he can trust.
Must have spoken to Foreman's parole officer.
Someone who will stick to the pneumonia. John Henry's on an experimental protocol for the paralysis.
I respect that. I'm not going to get in his way.
It's Foreman's case.
It's pneumonia. He can handle it. The guy's already paralyzed. How badly can he screw it up?
So, what are his stats?
Staying in the 90s on the nasal cannula.
Coughing up much sputum?
Almost none. He seems to be stabilized.
Dr. House, is anything back from Micro?
Yeah. You gonna fire me?
You can make up for it by washing my car.
Oh, this is fun.
Let's keep him on the broad spectrum antibiotics. And since he's displaying septic physiology, draw blood for adrenal and thyroid function.
About the paralysis?
We're sticking to the pneumonia.
You certainly are, boss. Like a wet tongue sticks to dry ice.
Mm.